FPQ 2016 Review. Basic Psychology. Theme: Memory. What is sensory memory? Modality specific, large capacity, no processing, lasts very briefly. Iconic, visual, lasts ~0.5 seconds, echoic, auditory, ~2 seconds. Information attended to goes to short-term memory. What is verbal memory? Memory of words and other language-based abstractions. Used when recalling an address with multiple items. What is iconic memory? Visual sensory memory. Holds stimuli for up to a second, enabling smooth visual perception. What is context-dependent memory? Enhanced recall when the context of learning and retrieval match. Divers recalling words underwater learned underwater performed best. What does dream work involve? Transforming latent dream content into manifest content. Latent content, unconscious thoughts, manifest content, what the dreamer recalls. Theme: learning and conditioning. What is shaping? Rewarding successive approximations toward a desired behavior. Praising a child for holding a pencil, then scribbling, then writing letters. What is a variable ratio schedule? Reward after a random number of responses. Explains high response rates in slot machine gambling. What is a fixed interval schedule? Reward after a set amount of time. Example: monthly paychecks. Quantity over quality. What is the primacy effect? Better recall of items at the beginning of a series. Relevant in serial learning. Theme: drives and motivation. What are secondary drives? Drives that acquire value through association with primary drives. Examples: affection, comfort, achievement, dominance, socialization. Which is not a secondary drive? Dominance, comfort, achievement, sex, or socialization? Sex. Sex is a primary drive, not learned. Theme: cognition and intelligence. Who proposed the two-factor theory of intelligence? Spearman. Tests measure general intelligence, G, and a specific factor, S. Which of Eysenk's traits is linked to reticular activating system reactivity? Extroversion. Less reactive ARAS leads to extroversion, seeking more stimulation. Social psychology. Theme: social cognition. What is the theory of mind? Understanding one's own and others' mental states. Deficient in autism spectrum disorder. What is an attribution error? Not included in this content. Clinical examination. Theme: interview techniques. What interview technique involves shifting topics? Transition. Moving smoothly between topics during an interview. How to respond to a patient crying during an interview? Use validation. It's normal to cry at difficult times helps normalize and continue. What interview technique helps clarify a patient's financial status? Transition. Let's talk about your family now exemplifies moving from finances. How to respond to a delusional patient discussing harmful plans? Explore their reasoning. Why do you think your neighbors want you to do that? Gathers information. Theme: psychological testing. What test uses pictures to assess personality? Thematic apperception test, TAT. Patient creates stories about pictures, revealing underlying needs, feelings. What test is best for assessing executive function? Trail-making test, TMT. Measures cognitive flexibility, task set inhibition, and response set. What test assesses current IQ in adults? WISAR, Wechsler Adult Intelligence Scale Revised. For individuals aged 16 and over. Descriptive psychopathology. Theme: thought disturbances. What is thought block? Sudden stop in the flow of thoughts. Symptom of schizophrenic thought disorder. What is thought broadcasting? Belief that others can hear one's thoughts. Like a live broadcast of thoughts. What is tangentiality? Organized but not goal-directed speech. Answers are indirectly related and drift from the topic. Theme: abnormal perceptions. What is synesthesia? Perceiving a stimulus in one modality through another. Example: smelling the noise of a trumpet. What is the most common modality of illusions? Visual. Illusions are not inherently pathological. What are obsessions like? Recurrent and stereotyped thoughts, impulses, or images. Often intrusive, unwanted, and about harmful or inappropriate actions. Theme: motor disturbances. What is stereotypy? Repetitive, non-goal-directed motor behavior. Example: rocking back and forth, head thumping, fist circling. What is perseveration? Repeating the same response to different stimuli. Example: answering January to both "what month is it" and "what year is it." Dynamic psychopathology. Theme: defense mechanisms. What defense mechanism involves expressing the opposite of unconscious impulses? Reaction formation. Example: unconscious hate expressed as conscious love. Which is a neurotic defense mechanism? Reaction formation. Others: displacement, rationalization, undoing, etc. What is sublimation? Channeling unacceptable impulses into socially acceptable activities. A mature defense mechanism. What defenses are common in borderline personality disorder? Projective identification and splitting. Seeing people as all good or all bad. What is loss of ego boundaries? Common in borderline personality disorder and other personality disorders as well as psychotic disorders. Feeling as though one's own thought process is no longer within the realm of control. Thoughts becoming confused or entangled. Human development. Theme: attachment theory. What is symbiosis in developmental psychology? Mother and infant perceived as a single entity. Mahler's theory of separation individuation. What are transitional objects? Objects that substitute for the mother during separation. Provide comfort and security. Examples: pacifier, blanket. What is an incorrect mother-infant attachment pairing? Unresolved disorganized, unresolved ambivalent, preoccupied resistant, autonomous secure, dismissing avoidant. Unresolved ambivalent. Unresolved mothers tend to have disorganized infants. Sociocultural psychiatry. Theme: cultural influences on mental health. What determines cultural identity? Upbringing and choice. Characterized by behaviors and attitudes. What is true about schizophrenia in African Caribbeans in the UK? Increased rates compared to their country of origin, Jamaica. Suggesting socio-cultural factors play a role. Theme: psychosomatic families. What is a characteristic of psychosomatic families in relation to eating disorders? Overprotectiveness. Other traits: enmeshment, rigidity, and poor conflict resolution. Classification. Theme: ICD-11. What's a new disorder in ICD-11? Prolonged grief disorder. Persistent, disabling grief beyond 6 months, culturally inappropriate. What describes an ICD-11 change? Disorders diagnosed at any age, lifespan approach. Example: conduct disorder not limited to children, adolescents anymore. What is a maladaptive personality trait in ICD-11? Dissociality. Used to describe personality disorders dimensionally. Rating scales. What kind of scale is the Quality of Life 16, QOLS-16? A self-administered scale. It can also be administered via interview. Measures 5 domains of quality of life.